Thank you so much, gentlemen, for being here today to kick off this discussion on the state of healthcare in 2024. Ladies and gentlemen, welcome. You're with Businessworld. This is Budget with Businessworld, but we're going to be talking about the state of healthcare in 2024. Before we kick off this discussion, let me quickly introduce all our panelists. We've got with us Mr. Sunil Khurana. He's the MD and CEO, BPL Medical Technologies. We've got with us Dr. Jaideep Menon, MD, DM Cardiology and a public health expert, Amrita Hospitals. We've got with us Mr. Joy Chakrabarti. He's the CEO of Hinduja Hospital and Medical Research Center. We have with us Mr. Himanshu Sikka. He is the Project Director, Samrid, and Chief Strategy and Diversification Officer at IPE Global. We've got Mr. Yatharth Tyagi. He's the Director at Yatharth Hospitals. And of course, I have with me my senior colleague, Mr. Ashish Sinha, who's the Senior Associate Editor at BW Businessworld. So before we begin our discussion, I'd like to invite Ashish ji, if you can give us a little bit of a sense of what the Honorable FM said yesterday in terms of the healthcare sector.
Hi, good morning all. I'll just quickly take you all through what she said is all known to us, but the numbers through the budget documents and how important healthcare sector has been for this government. Like to start with, when this government came in 2014 year, the total spend used to be just about 60,000 crore allocation to the Ministry of Healthcare. Now that has shifted up almost by 50%. So for 24-25, as per the budget documents, government intends to spend about 90,200 crore in the next financial year, obviously subject to in July if the numbers go up or down. That is the good part of it. Last year, in the last financial year, the intent of the finance minister was to, for the healthcare sector and the Ministry of Health and Family Welfare was to spend about 89,000 crore. That is the intent was there. But once we go through the fine print of the budget, we find that almost 10,000 crores have not been spent as per the budget document. That's one highlight point. Now, there are major outlays for the healthcare sector under the ministry. Like, for example, for National Health Mission, the allocation was about 34,000 crore, almost 3,200 crores have not been spent. Next year, they have increased it next financial year to 38,200 crore. That's their good intent. Similarly, for Ayushman Bharat, which is Pradhan Mantri Jan Arogya Yojana, they have proposed a higher outlay of 7,500 crores. And for this current fiscal, they had announced 7,200 crores, but almost 320 crore have not been spent. So the total outlay, the spend remains same with the last fiscal year. Similarly, for the Ayushman Bharat Health Infrastructure Mission, almost over 4,200 crore has been allocated for the next financial year. And 4,200 crore were allocated for the current financial year, but only 2,100 crore have been spent. So the broad takeaway point is that intent of the government is to allocate higher money for health and family welfare, which is a good thing. But this unused amount has been a pain point. Like finance minister talked about opening of new AIMS and all. The ground report is that in last 10 years, only 6 AIMS have been operational. Rest, the work is in different stages. So intent is there. Allocations are being made, which is much higher than the previous government, but much more needs to be done. And that's where private sector comes in. That's where you guys have the contribution of the thing. So if you could all just quickly, give your reaction to what was said, and as per the numbers which I have shared, it will be great.
We can start with Dr. Menon. A quick reaction.
Thank you. I would think it's certain heartening features with with this particular budget, keeping in mind that it's still an interim budget. The heartening fact is that they brought 1.2 million Anganwadi workers and 1 million ASHA workers who are there all over the country into the PMJ fold, in the sense that they are now, all of them would be bearers of a PMJ scheme card, which allows them free treatment up to 5 lakhs in select private hospitals as also public hospitals. The more heartening feature is that the vaccination drive against cervical cancers, that is, which is one of the major causes of cancer even now in females, that has been brought under the ambit of vaccination. But what has not been specified is whether it's a quadrivalent or nonavalent vaccine, because the cost difference is considerable. One, the quadrivalent coming to 4,000, whereas the nonavalent is 11,000. Those
Mm.
were my first reactions. It's a welcome change from the usual universal healthcare coverage policy that we've seen umpteen times, in which they've looked at particular sector and keeping in mind that this is a election budget, they've tried to bring women and children under the fold.
That is
Over.
true. That is true. Mr. Chakravarti, if we can get a quick 30-second reaction from you, please.
So I think I'll echo what Dr. Menon has said, that two things have happened in the healthcare delivery front, like, increasing the number of Anganwadi workers, and we feel the primary healthcare needs to be strengthened, and there is an attempt to get that done. And the women's health and the cancer burden for the woman is high, and the vaccination program is definitely a good move. But most heartening thing to see the how the technology has come with the EUWIN app, and where entire country, entire nation can log in and they can record their entire vaccination thing. I think that will help us in a long way. The other part may not be directly to healthcare delivery, but very much connected the research. The kind of investment commitment has been made for the research purpose. It is good. And to support this entire phenomenon, we need to have good healthcare workers and people to support the entire infrastructure. I think an attempt has been made to get more number of medical colleges, strengthening the nursing colleges which were declared in the last budget.
Yeah.
That is going to take us in a long way. So I think this is a good move, but we are keeping our finger crossed to hear some more in the budget post-election.
Yeah, that's true. Sunilji, can we get your quick reaction?
Yeah, thanks, Jyotsna. No, what Dr. Menon and Mr. Chakravarti said, I mean, that's anyway there. But from the medical devices side, I see a direct relationship of infra growth. And there is a lot of emphasis on the growth of infra. So when I say infra, you're talking of more medical colleges, more hospitals. And if you have more hospitals, the medical device requirement will grow proportionately. That's where I'm clearly coming. One point which I felt was not touched, and that will probably come in July in the full budget, is that there was a commitment by FM, an honorable FM, some time back, that up to 2.5% of GDP will be actual spent in the healthcare. And this is a movement from about 1.25 to 2.5%. That's a big number. If we achieve that by 26, which is what was the promise some time back, that will really be a big help. But we need to really wait and watch for that.
Mm-hmm. Mr. Sikka, if we can get you in.
A lot of points have been covered by the previous speakers, but
Yeah.
just to add and give a different flavor, two things that I found very interesting in this budget speech was one was the focus on comprehensive maternal and child health care.
Yeah.
And that's something which the country has been grappling with. We have the highest levels of anemia in the country. And while maternal and child health indicators have improved over the years, still the burden in terms of the overall growth and overall has been a challenge. With these two kind of areas and these two, like the issue is handled by two different ministries currently. So if the policy direction is towards getting into a comprehensive planning in the near future, that's going to be a very, very welcome step, and one would need to wait for the next government to come in and take that forward. And second point, which kind of resonates with Mr. Khurana also mentioned, is the entire focus on infrastructure and related focus on the startup innovations as well, besides research. So the startup incubation and the kind of incentives that were again mentioned in the budget about the startup guarantee schemes and the startup funds and the fund of funds, that's going to take medtech industry a long way, not just for India's consumption, but also India as a provider for cheaper medtech devices, good quality medtech devices for the global world, as we have done in the pharma space.
Yeah.
These two areas I felt that were really encouraging.
So before we move on to our discussion on the state of healthcare, I'd like to get Mr. Tyagi's views as well, please, and then we can.
Yeah, so in sync with all the speakers who just mentioned most of the points that were covered in the budget, I think it's a good interim budget for a Viksit Bharat, the vision that our PM and the FM had been portrayed. It clearly focuses on the prevention aspect of the healthcare. But at the same bit of time, I think what I had foreseen was the talks that was going around about increasing the Ayushman coverage from 5 lakhs to a much more higher amount. I think that is something which would be still expected in the full budget that is expected later this year. But I think other than that, as far as it focused more on the provisional aspect of the treatments of the healthcare. So I think a lot has yet to be seen on how these execution as well as the complete spend of this healthcare budget would be portrayed in the coming months.
Right, thank you so much. Sunilji, wanted to come to you to kick off this discussion on the state of healthcare. When you talk about, we were having that conversation earlier about the medical device industry. So if we look at the last few years, what do you think we've done right? And what are the challenges when we move towards progress?
Yeah, actually, I will take it back to COVID now. We all know the pandemic. When pandemic was there, we got really exposed that our number of ICU ventilators to a number of patients and all of that was much lower. We were truly not ready. So medical devices, we all felt that we are not doing that great. And that too with a lot of importation. Today, there is a dependence of about 80-85% to come from outside. And that's the time when PM pushed everybody that we should go for a self-reliance. And we saw a Make in India initiative, a drive coming big time. We also saw PLI coming, production link incentive. I mean, we as a BPL medical also got into that and got 2 applications done through that and started building a new factory. So that was a big trigger. And that also triggered, once you talk of a Make in India, you also triggered toward the R&D. And I see lots and lots of R&D drive now with the IITs of the world. They are incubating a lot. Internally, we have started building a big R&D team. So that was one area which I felt is very good. Another area which we should also see, that at the time of COVID, we realized that we are getting a lot of spurious material. I mean, we got oxygen concentrators which were giving only 40% good oxygen against the 90-92% which is recommended. So then the government launched a very strict and very good quality of regulatory policies. Of course, initially when policies are launched, it will be always a little difficulty because they will learn, they will take time to build it. But yeah. I feel the way CDSU is now working with a very small team, they are tightening it. And from class A, B, C, and D, all the range of products, we have to get the product approved to bring it. So that's a very positive thing in my mind, that this is something good, that you will have a right regulated product, which are good and going to patients in hospital, and a lot of drive toward the Make in India. I have a very strong belief that in years to come, we will become, I don't want to truly say China +1, but clearly we will get a good option as an Indian manufacturer for the rest of the world. The only thing what we need to keep in mind is that we need to learn to compete, not only look for some subsidies. We must build a product which are high quality, global standards, which can be taken outside. And in the meantime, value chain has to be built. I mean, and that again, huge drive. 2 days back, I met DOP Secretary, Mr. Chawla, and more like a luncheon meeting. And he's also committed that we'll build a very strong value chain so that you all can get a lot of benefit from there. So right. Things ahead, but it will all take time. It will not happen very quick.
Sunilji, just a follow-up question. You recently were mentioning you met Mr. Piyush Goyal. This production link incentive scheme has done wonders for the mobile handset sector and in the consumer durable sector a bit. Do you think such kind of similar thing should be actively promoted for medical device industry also to incentivize them?
It's already being launched, and not only production link. There is a new scheme also getting launched with the R&D link also. So there is a lot of R&D subsidy and R&D support. Both are now working, and that was a good meeting because as an industry minister, he invited few industry leaders and had a face-to-face good meeting for nearly 4 or 5 hours. Unheard. I mean, these kind of things are really unheard. That you are taken, in confidence that please share what all you want us to do, and then we will prioritize it. So I think we are in the right direction. On a PLI, I can say that it is still needs to be more fine-tuned to become more for small players, because you have to address SMEs also. SMEs, if you don't address that, then you can't create a big infrastructure or hub. So that is where we have recommended. And I think things are moving in the very positive direction. And great meeting. I mean, we are getting a lot of calls directly from Invest India and all of them that, what do you need? Today, we have built a new factory, which is 95,000 square feet and waiting for a few approvals. But very, very good outlook. And I'm pretty sure that India will become a powerhouse as far as medical devices in next 5-7 years.
Thank
Right.
you.
So I think Ashishji, you wanted to also ask Mr. Chakravarti about. So I'll give it back to you.
Yeah, that's an open question, sir. I mean, Central can spend whatever limited they can spend and focus. We are also a federal state structure country. So a lot of state governments are they, is health a priority for them and focus in terms of incentivizing hospitals for expansion, or land permission, or several municipal permissions are required. Is that a challenge, or do you see on ground a lot of support coming from various state governments?
So yes, Mr. Sina, as you asked this question, will try to be as much as apolitical in my answer. So I see a mixed kind of response from different states. As you told very correctly, in India, health is a state subject. So government can give the overall policy framework, and they can give as an advisory or as a guideline to the state to adopt it. And during different schemes, and I'll take you out little out of the directly infrastructure to something like organ donation. If you think about organ transplantation donation program across the country, some of the states have done proactively very well, and some of the states are lagging behind. It is because of probably the inertia, the priority what has been taken by the government. Now coming back to your question, I'll not talk about the tertiary care first. I'll talk about the primary care. In the primary care aspect, if you see the proper infrastructure, if you need to create probably in healthcare, you need to have a solid primary care facility. Otherwise, everything can become a burden on a tertiary care facility where some of these patients even need not to visit. If you go back in 1963, the first committee, board committee, which was appointed by then government, they gave a fantastic roadmap that how Indian healthcare should work. Still today, I feel even after 60 years that is very pertinent and prominent thing what we need to adopt. What it says that government should create, depending upon the population size, the units of healthcare delivery model, like whether it is primary health center, whether it is community center, whether district hospital. But unfortunately, it is not happening in many states in that way, and which is basically making the healthcare a little difficult to achieve the targeted goal. I'm happy in this budget they have tried to strengthen the Anganwadi workers, which is again one of the very strong pillar or backbone for any healthcare system to get strengthened in any particular geography. Coming back to the tertiary care, and especially if I want to touch upon the private sector, I can tell you some of the states, some of the municipal corporation, which is again the basic administrative unit for any locality, they have made a very proactive approach by keeping healthcare or hospital allocated land or place where they encourage people to come up. In some cases it is missing, and when you have this, you get a very cheap land or property which you can convert for a hospital. And when you do that, your input costs become less, and that becomes very helpful. I'll take this is about access. Now I'm talking about the affordability. Now, affordability aspect, the fantastic thing has come PMJY few years back, and what we have seen that unfortunately some of the states have not taken up this as a this as a scheme for their own state for whatever reason, whatever political reason they have in their mind. But this kind of coverage, universal coverage can really strengthen the healthcare delivery system, can really empower people, especially those who are bottom of the pyramid, them to come up, them to avail good healthcare, even from some of the prominent healthcare facilities. So we see there is a difference, and I can say that yes, it depends upon state to state and administration to administration, but hopefully things will become stable one of the days and we can see a better result.
I'd like to bring in Mr. Sikka here now. Actually, based on what has been discussed so far, if we were to just look at going forward, what are the key, what is the policy push that we require, or what are the key aspects that we require government support in? What would you say? How do you kind of just sum that up?
Yeah. So if you were to kind of look at the last 10 years of the two phases of Modi government, a lot has been done on the policy level. Many things that Mr. Joy Chakravarti said and Mr. Khurana also mentioned kind of clearly shows that the focus has been on strengthening universal health coverage at different levels, be it primary, secondary, or tertiary, be it the health and wellness centers, now the Anganwadi center strengthening, or the strengthening of district hospitals and setting up of AIMS. What Ashish mentioned earlier, that even though the intent has been there, the policy framework has been put in place, the spending has struggled, and that has been a challenge. And I think going forward, if the government has to kind of really see policy intent getting implemented, one thing where things have been a bit laggard has been the private sector participation. And the framework to kind of ensure private sector is seen as an equal partner and not somebody that will come and benefit from public funding, but it's a critical component of this entire ecosystem and to contribute to it and to kind of work towards the welfare of the masses. That I think so is something which national government needs to push a bit more, and state governments, of course, need to implement kind of a focused approach. With that happening, I think the policy framework overall that exists, India's private sector is quite committed and is focused towards bringing best health outcomes in the country, and together with public and private sector, kind of a dual strategy, the government can see much better results on the ground. So that would be, I think, so one big push that government needs to make. And second push, which has happened in the recent years, but can be further kind of taken forward, is the entire Made in India kind of thing, and incentivizing more and more early stage companies to kind of try out their innovations and scale them up. We have platforms like GEM and all put in place where public sector intends to procure from private sector, but the challenges still exist there. So again, streamlining of those things, having different set of criteria when government is procuring from early stage companies in the healthcare space need to be brought forward. It's in all, I think, overall push towards better private sector engagement, both at established players as well as with early stage companies.
Right, right. So now let's move on to something slightly different. I want to bring you in, Dr. Menon. Wanted to talk to you a little bit about cardiac care in India. As you know that, I mean, we all know that it is cardiac disease is one of the biggest issues that we look at, but we've made a lot of progress in this area. Could you give us an overview of the progress that we've made and where we've sort of headed?
Thanks, Josna. What I should point out is it is not one of the, it is the major cause of mortality and morbidity in
Yeah.
India as anywhere else. In most LMICs or high income countries, the number one killer and the largest proportion of patients are with heart disease. So, what can we actually do about it and what have we done right? The first thing is that we recognize that heart disease, strokes, cancers, chronic respiratory diseases are the major causes of death and hospitalization. This realization came only in the early 90s. That's when the shift came from communicable diseases to non communicable diseases. Till that, it used to be vaccines, antibiotics, and all the development used to be on that front, alongside maternal and child health. It's only about 15 to 18 years back that we opened our eyes to this huge pandemic of non-communicable diseases. So what have we done right? Not many things right, in the sense that 70 to 80% of cardiac care or neurological care is actually through the private sector. As with anything else, for the health of the nation to actually improve, this is to be inverted to 70 in the public space and 30 in the private space. You have very well functioning health systems in, say, Sri Lanka, Bangladesh, Thailand. Why it is so is because it's primarily driven by the public sector. It's not as private sector driven as it is here. So what can the government do? What they're trying to do is to, what the community level hospitals, the primary health centers, working your way up to the community health centers, taluka hospitals, and the district hospitals. There's a system of care starting from the sub center, where the primary follow up of individuals with risk factors that are which are risk factors for coronary artery or heart diseases, if they are identified and taken care of early enough, then the progression to heart disease actually stops. So what we need is a focus on preventative care, and that is where the FHCs are so important. You have a we all argue out about primary health centers not having enough of doctors, and that is true that most doctors would want to go ahead and do a specialization. So you have cadres of alternate systems, that is Ayurveda or homeopathy, actually manning the FHCs. They actually do their way and approach to an individual is much more holistic than what we modern medicine people actually do, but they are not allowed to prescribe uh, allopathic drugs. So if you place an Ayurvedic practitioner in an FHC and do not allow him to prescribe paracetamol or ibuprofen, you're not going to be able to actually improve the health. So
Yeah.
if I were to summarize, it should be that preventative care is what we should be paying our attention to. And there are easy measures to actually look into that, in the sense that insurance company policies have to change. Preventative care is not insured, in the sense you have to be admitted for
Hospital.
claiming insurance. So that is one policy decision that has to come from the top to change that policy, and the insurance companies have to be brought in the loop. Number two, everyone above the age of 40, just like if I were to take a driving license at the age of 40, I need my eyes tested. So that is the law. Similar to that, if I were to get individuals above the age of 40 to test their blood sugar, blood pressure, and just the total cholesterol, all of which would be come to less than 100 or 110 rupees. That itself would go a long way in actually being able to pick people up before they go into full-blown disease. So in a single word, in a single sentence, it is primary preventative care, strengthening the public health system. And this just resonates with what Mr. Joy Chakraborty and Mr. Sika actually said.
Yeah. So I know that we're running out of time, but I also know that Ashish ji wanted to has a question for Mr. Tyagi, and then after that we'll come to all of you for your closing comments. But
Yeah, Dr. Menon just touched upon it. So quality healthcare industry and the success of healthcare industry is directly related to the quality of medical professionals. So, Tyagi ji, in your opinion, do you have a wish list first of how to increase quality medical professionals, be it doctors, technicians, nurses, etc. And if what can government do, both at center at the state level, to expedite this process, because there is a huge shortfall on population to doctors and medical staff. What's your experience been, and some suggestions if you have?
Yeah, I mean, also adding to the previous discussion about the correlation of the federal and the central government into how, the better quality care is being provided. If we talk about in, Delhi, NCR, and Uttar Pradesh, where we are based out of, we have seen a huge support from the state governments of both the state in terms of, not just the infrastructure, but in terms of policies of, so one of our hospitals, we recently got accredited for nursing colleges. So we are starting the course of nursing teaching there, as well as the courses for, DNB. So DNB is another very important aspect into educational system where, the post MBBS students, they join a hospital and they work there for 3 years, and they get a degree equivalent to an MD degree called DNB degrees. And the more the government is able to push these courses in private hospitals and enhance the qualifications of private hospitals having the accreditation towards DNB courses, I think that's a great way into enhancing the availability of doctors, producing more quality doctors, and that's a very good use of private setup into, if because if the having medical colleges is one aspect of increasing healthcare professionals, but if you allow private hospitals to do their bit and allow them the accreditation for the courses of both nursing as well as DNB, and if more and more private hospitals are now coming forward, especially in North India, for these courses, I think that's a great way the federal government here is supporting us in terms of adding to in the infrastructure of healthcare. And also, I feel it is the availability, if I see across Uttar Pradesh, how the new government is pushing for a lot of PPP models. So right now, there are a lot of cities across Uttar Pradesh where government is proposing or asking private players to come forward and, collab with the government into starting new medical colleges. And I think that's a great way where PPP model is already being successful across cities in Uttar Pradesh. And I think the federal government is doing amazing job into enhancing the overall healthcare infrastructure which is required.
Thank you, Tyagiji. As closing comment, as we come to the end, I'd like to throw open like two questions. One is your two wish list which you would like to see in July as full government comes in for the healthcare sector in terms of policy and taxation related issue which has been plaguing some of the supply chain in the healthcare devices and other sectors. And two, how do you see Indian healthcare system if you look at NHS of UK or the Canadian healthcare system? Where are we if you have to make a comparison? This is an open question. Dr. Menon, if you can take it up first.
Sure, I'll take your second question first. I think we are doing far better than the NHS as of now. People are leaving the NHS, not enough of nurses or doctors in the NHS system as of now. And if any one of us were to fall ill in the UK, you would know how difficult the system is to crank up, in the sense acute emergency care is taken off. But other than that, to get an appointment for any other disease takes months together. And an individual may as well lose his life in the intervening period. Number two is my wish list as to what the next budget should actually show is to increase the health allocation to 3% of the GDP. That would be ideal. Keeping in mind there are countries with 13 to 16% of their GDP, but 3% would be very good. And number two, to concentrate on diseases that are our very own, in the sense that you have diseases called neglected tropical diseases, where the high-income countries would not support by way of any research of any sort. For example, snake bite. We lose about 58,000 individuals to snake bite every year. That's individuals between 20 and 65 years of age, usually in the rural areas. So these are our own issues: dengue fever, leptospirosis. So the government should pay attention to neglected tropical disease. This, keeping in mind that India is positioning itself big in the South-South cooperative sectors and as a leader of LMICs, I think we should take the lead on this. Over.
Sunilji, you.
Oh,
So-
that's
My view is that regulatory bodies to help us with a little bit more time-bound outcomes and approvals. That's the one which I feel. Second is that academia partnership with the industry. This has to be a mandated. And this is not only engineering institutes, even a medical institute, so that we can together work and build up products which are global product from India. So these two can help. The last point is that we should raise the entry barrier for our products which are coming from outside. If the same products are made in India, you have to help Indian companies to start with for some time, and raising some of those entry barriers are important. Thank you.
Mr. Chakrabarti. closing
So I
comments.
think before me, the other panelists have given very important points. But just to add something different, I can tell you that our wish is to get 3% of GDP. But again, what we have seen, the earlier years, the budget what was allocated, that has not been completely consumed by the departments and may not have been completely utilized. So what we need to see that currently whatever has been given, and if we can get little better off in July, the dream what we had in 2019-20 in terms of PMJY wellness center in the rural areas, if we can develop those infrastructure, then it will be very good. Secondly, overall, the delivery part may not alone flourish unless and until the entire ecosystem gets developed. So, what we have seen in other countries, the insurance, the medtech, everything they come hand in hand, and then when they work together, you can get the cost-effective healthcare delivery, which is the need of the hour. Because today, when you think about quality care, in one hand it comes the cost, because some people they perceive it is a cost burden to get a high quality care, but the same high quality care how we can get at a cheaper cost or at a reasonable cost, that should be the aim, and policy should be framed along that line. So these are the two wish list.
Perfect. Mr. Sikka, if we can have your
Yeah.
son.
So, besides the points that the previous speakers have also already mentioned, two areas I feel can strengthen the health tech ecosystem better is one is setting up a healthcare innovation fund, which uses innovative financing mechanisms to make affordable capital available to Indian medtech manufacturers, both early stage and established ones. So, government's focus on that would go a long way. And something which kind of Mr. Jaideep Menon also mentioned, focus on not the routine diseases, the emerging challenges in the healthcare space, whether it's the NCDs or climate-induced health diseases that are going to see an uprise in coming years, whether it's because of additional rains, vector-borne diseases, because of heating of the weather. Again, we were now finding cases of malaria coming up in places like Uttarakhand, uh, or whether it's heat-induced illnesses that are going to see kind of increase in coming years. The government needs to kind of maybe set up a mission for climate and health and take that forward in ways Ayushman Bharat has taken in many of the areas.
Right. Mr. Tyagi, if we can get your comments.
I think India at a global level is already doing quite well when it comes to healthcare infrastructure. But I think just two important areas where I would expect the government a bit more support is, if we talk about the allocation of funds in the Ayushman Bharat scheme, in order it to be a truly universal scheme, much more needs to be done for the private setup coming forward and getting the accreditation for this. There are still some teething issues where a lot of private hospitals we talk about right now in Delhi NCR are not empaneled with this, and the funds are still there in the scheme to be spent. It's not that we need some new allocation or new schemes to come out and take this forward. The fund allocation is still there in the Ayushman Bharat. It can be much more utilized. And I think the utilization of this fund still pending in the Ayushman Bharat should be into ensuring how it reaches much more hospitals, whether it's the pricing revision that needs to take place. Yes, there was a recent price revision in the CGS rates that we all applauded the government for. But even in the Ayushman scheme, much more scope is there if we want to truly make it a universal scheme. And I think if we're able to do it, then the healthcare infrastructure in India would be truly the best in the world.
Thank you so much. Thank you all for being here and for talking to us. And right, so we're moving in the right direction. All eyes now on the next few months, let's see, and hoping for the best. Thank you so much for your time. Have a wonderful day.
Thank you.
Thank you.
Thank you.
Thank you.
Bye. Bye.